now tuned in to the Cold Hard Truth, Cayman's #1 hard-hitting live podcast show, where we feature some straightforward conversations on political, social, and celebrity news and all things happening in the Cayman Islands and around the world. This show was created to give the people a voice and a means of being involved and informed without any filters. Sometimes it gets crazy, but we always keep it real. We bring you the tea, piping hot, so grab your favorite beverage and join the conversation via WhatsApp at 324-1612. Email tips@CaymanMarlRoad.com. Now, here's your host, Sandy Hill, broadcasting live from the beautiful Cayman Islands.
Tea with Sandy.
Cayman's top news headlines of the day from CMR.
All right. Good morning, Sandy. How are you?
Hey, good morning, Blake. I see you in the studio by yourself this morning.
I am. Aaron is at home because...
No.
Yeah.
Don't say it.
Somebody at her school, at Sprague's school.
Oh, my God.
So she's staying home as a precaution right now until she hears more. Like
yeah.
She could be in the studio, but... and Erin's on the phone with us, so she's listening in as well.
Wow.
Yes. Hi, Sandy.
Morning, Erin. Well, of course, you know, we were the first media to report that last night about Sprague's and others.
Yeah. I mean, you know,
it's a little crazy.
Are getting informed, and I just have to say, like, Sprague's is, my kids have been going to Sprague's since they've opened, and they've always been a great school, and just the communication between them and us has been phenomenal. So, we're all staying home today out of precaution of just waiting to hear back more and see, are we affected? What do we have to do next?
Right. Now, Erin, last week, I'm going to put you in the interview seat for a second here. Last week, when we were talking about all this kind of stuff, did you ever think that by next week, I'm going to be one of those parents impacted by this potentially?
No, but you know what? It's always been in the back of my mind. Like it's going around and you see school after school, person after person, where they're saying no contact has been made with another positive test. So it's out there. I mean, we once we've been to where we're at and kind of let it out in the community, it's a matter of time because this thing does spread like wildfire. So here I am.
Yeah.
Yeah,
Wow.
we were just talking about it over the weekend. Like, there's a potential for. I mean, there's a lot of us here that work at broadcasting that have kids in schools and all different schools. So, I could get a call later from CIS and be like, "Hey, somebody is, tested positive. You're in lockdowns." It just, and we're not ready for that. Like, we don't have that. We don't have 14 days of food, and we both work full time. It would just really upset your entire life for a couple of weeks for sure. So I feel bad for especially for all the parents going through it right now that are doing the homeschool now.
Yeah.
Because I'm sure that's hard for some parents because I'm sure they work. So.
Well, and the resources, needed to do something like that. Not everyone is as fortunate to have all the resources at their fingertips to teach a kid at home.
Yeah. So what do we got, Sandy? What do we besides?
Wow.
Yeah.
Well, it was a busy weekend actually.
Yeah.
So
start with
up
Friday
first,
or Saturday.
yeah, I mean, I had to go live on Saturday because we had a break-in situation in Honduras, in the Bay Islands, with a fire breaking out on Banaca, also known as oh gosh, I just forgot the Spanish version of the word, Guanaja. So we're going to be speaking with Mr. Sean Holder live this morning to get an update on where things are. I think something like 100 and at least 25 homes were destroyed because of this single fire. It ravished. I mean, it was amazing to see the footage that came out of that fire. Devastating. So, of course, a lot of Caymanians have connections to the Bay Islands, Rotan, Banaca. The other third island is Utila, which we hardly hear anything about. But so a lot of people are galvanizing their resources to see how they can help family, friends, and just other human beings who are in a terrible state as a result of having lost everything. I mean, I saw some of the after video footage and it's shocking, really. But, we're in a position where we can help. And so I think that, we're obligated to help. There's some people, thankfully, there was no apparent loss of life, but there are some people I understand who did get severe burns and they are critical. And some people got smoke inhalation. So we're going to try to get an update from Sean this morning about kind of where things stand.
Oh, man.
Yeah.
Yeah. So that was pretty crazy.
So locally, did you, what happened with that protest on Saturday?
Oh, right. So my apologies. I didn't actually go to the protests. I'm going to talk a little bit this morning about why. There's some people who's trying to ride me about, you've got to be fair and balanced. And I want to be very, very clear here. This is one topic that I don't have any intentions. I'm going to be fair and balanced on the side of science. You know what I mean? I'm not going to be fair and balanced when it comes to spreading misinformation and giving people a platform who I don't believe deserve a platform. It was, I was thinking about it a lot. And it was like, if I were around back in the 60s, Blake and Aaron, and Martin Luther King was marching, right? And the other side was out there, I don't know, doing whatever they did back then to propagate their hateful message of separate but equal, is what they wanted people to believe. Me giving them an audience and a platform would somehow try to normalize that. And I think there are times when the media has to make a choice between right and wrong. And it's as simple as that. It's not about trying to be discriminatory. And right now there's a lot of words out there that are being thrown out to try to elicit an emotive response from people, like, oh, you're discriminating against me. Oh, you're what are some of the other words that I've heard? You're bullying me because you're trying to put out correct information out there. And I'm thinking, providing factual science-based information that you may not like because you're a conspiracy theorist or you're an anti-vaxxer, whatever, doesn't mean that that person's a bully. Like, it's just, to me, it is astonishing. And those people, they want a platform and they want to be able to say every single day, as much as they want, fake news and fake information. But the second you try to counter that with science-based information, research information that's coming out, all of a sudden you're a bully, you're discriminating against them, you're what's the word that they use now that's another catchword? not fireballing them, but gaslighting them.
Yeah,
I mean, they just pick on all these words, and half the time they don't even know what the heck those words mean.
So
And
what
I'm insulted really that they even try to use those words against something that should be.
are you surprised though? You know what I mean? Like
exactly.
You know what? I am surprised by some of the people that I expected to be more logical and more thoughtful in how they receive information. That is what surprises me.
You're trying to put a rational thought in an irrational mind. That's what you're trying to do.
I know very smart people who have somehow just some mental block of actual facts, and I don't get how these people can be as smart as possible, as smart as they are, with having this like mental block for facts.
Absolutely.
Yeah. So what were the numbers on Saturday? Yeah, I mean, I heard different variation of different numbers.
Yeah, we put up something about it being less than 50, and of course that got them all in a tizzy. And we heard estimates from, according to them, from hundreds of people. I think the Compass said between 400 and 500 people. And then we heard estimates up to 1,000 people, which is ridiculous. So some guy messaged, he's like, "Oh, there's 1,000 people there."
Well, the video didn't
get your facts straight. And I said, really?
It looked like maybe about 100, maybe.
Yeah. So believe it or not, what I had someone do is I had someone go through and actually count, because we had gotten video footage of the procession, like from the beginning all the way through. Like someone actually went through and recorded the whole thing. So I have had someone count. We're going to watch that video this morning because I'm not here.
And so what did they come up with?
208.
Okay.
Yeah. So listen, information is what it is. Facts are facts. You know what I'm saying? Yeah. I'm not here to put any misinformation out there. I said at the time that I'd heard 50. I wasn't out there. So, I'm taking somebody else's word for it. I think the Compass said that they counted about 100, 150. Not the Compass, sorry, Radio came in. So I figured it was somewhere between that and the extreme number that the Compass is putting out there. Now, Andrew Harris, to be fair to him, he said he counted it. So, it's, I looked at it and I thought, well, Trump math could be at play here.
Yeah.
I don't know. I mean,
it really doesn't matter. It's a minority, and
for sure. But their desire to overinflate the numbers is somehow pushing the point that so many more people support this position. Well, let's be very, very clear here. We have 73% of the current population who are vaccinated. So no matter how you slice it, I mean, even if you had every other person, what's 100 minus 73? You would not be in the majority. You wouldn't be anywhere near it. So, I think we have to just be very, very clear about their agenda and what they're trying to push. And the level of misinformation is just absolutely shocking.
So there is and there's another one this morning. There's a road closure on Fort Street because of it, right in front of Parliament. So they're closing the road, which will jack up traffic, of course, this morning.
Holding the borders closed and now traffic. Great.
Yeah. holding traffic hostage.
Blocking borders and traffic.
Yeah, exactly.
It's just
and that's this morning. So what is it that they're protesting exactly?
Well, I don't know, to be honest, because there are people there all over the place. So there are people there who are obviously anti-vaxxers. There are people there who don't even believe the vaccine exists. There are people there because they were Trump supporters and they're wearing a Trump and Pence shirt.
I saw that.
And by the way,
I mean, it clearly ran the gamut. So it's not like they were unified of one mind.
Yeah,
it ran the gamut. So they were attracting anybody on the fringes of this whole thing. Is basically what it was.
Aaron was just saying that Trump is vaccinated as well, by the way, which is true.
Of course he is, because as sometimes as strange as his thought process is, I think he probably has a bit more sense than maybe some of us want to give him credit for. At least he knows to vaccinate.
He's using those money. He wants to live to spend that money.
That is true.
And he also, they're his insiders that he downplayed, the impact of the virus when he had it. But once you've had it, I think you have a real idea of what you're dealing with.
Well, he almost died.
Yeah, he did.
Yep. He just had very good medical care.
Yeah.
Yeah.
The best. Sandy, anything else before we let you go?
Yeah, I mean, we've got quite a bit to talk about this morning. So the HSA is going to be joining us, a member of the HSA team, to go through how to sign up for their online portal. Like, we're going to walk people through it step by step.
Do they have the QR codes yet? Because I'm just
no. Well, that's what we're doing this morning. We're going to show people how to get it.
Oh, you
I
can
haven't done
do
it yet. So we're going to do that in real time.
I know that before you could sign up, but you couldn't get the QR code yet. So I was just waiting until the QR codes were available, and then I was going to sign up. So is it available now?
Yes,
Okay.
yes, it sure is.
Awesome.
So yeah, we're going to be
contact me so that I can know what I need to do next.
Yeah, exactly.
Yeah, so we're going to be going through that this morning as well.
Really quick though, Sandy, what happened with this boat party? So someone was going to travel?
Yeah, so this was a little bit confusing, I feel like, because we put up the post. Obviously, CMR had the news first that this person had tested positive. But what happened was he was planning on traveling. I don't know where he was going, because remember now, even if you're going to Cayman Brac, you require a negative PCR test, right? So he might have just been going to the sister islands. I don't exactly know where, but he had intentions to travel. Went in to do his PCR test, and then that day he went out on a boat cruise. And as it turns out, literally as he's on the day-long boat cruise, and it was like a private charter or whatever, they get the news that he's positive. So of course they're like, where's this guy? We need to get a hold of him right away. And of course, he was in an environment that could potentially be a super spreader sort of situation, right?
For sure.
So he was on a boat cruise with upwards of like 30 people or whatever. So the public health authorities actually went to the location, because the thing about that is you don't want those people to leave and then try to figure out afterwards who they were. Like, who were you in the boat cruise with?
Yeah.
So
Meanwhile, they're interacting with, hundreds of other people.
Yes. And I think that was the right thing, is to go to him right away.
So he just had a community transmission. He had no idea. He was just going to travel and got a test. And then they were like, oh, hold on a second.
Exactly.
And then they found this guy, and then he was on a boat. Like he just had no idea.
Exactly. Wow. So yeah, so I mean, that must have been shocking news for him to be.
Yeah, nobody's going to invite him on a boat party for a while.
That must have been shocking news for him to get off a boat and be like, "Hey, you're COVID."
That's what I mean. Like, that's what I was just saying. You could just be contacted, and your life upended for 2 weeks. It's going to happen to a lot of people.
Yeah. And it won't just happen once, I don't think. I mean,
that's true.
This is where we need to look, for me, and I've said it constantly, I'm glad I'm vaccinated. Everyone that can be vaccinated in this house is. Now, when my 2 kids that are under 5 and under can be vaccinated, then, we can probably go about our day a little bit more, freely, and not as, worried that, I don't want to be that one statistic with my child in the hospital.
Yeah.
Yeah.
Anyway.
So we got a full slate of topics to cover this morning, going into coming out of a weekend. There was quite a bit, that was going on. So yeah, we're ready to rock and roll. It's tea time.
Happy Monday.
Thank you.
All right, catch Sandy on CMR on YouTube and Facebook right now, and we'll see you tomorrow, Sandy. Okay.
All right, guys, have a good one.
Aaron, what you got coming up?
Aaron.
Oh man, let's talk about Britney Spears.
Modern technology, you gotta love it. Aaron can be at home in this day and age, and actually still work, still on the radio. Isn't that amazing? So let's talk about, we got a lot to talk about, actually. We're going to hit the ground running here this morning. We are waiting to hopefully touch bases with our contact in Banaca, Honduras, to see what the latest is, so we can check in with them. So I think we originally told him around 9-ish. So we'll just be waiting for him to advise us of when he's ready. So good morning, Marshall. Good morning, Diamond Princess. You guys notice I'm not wearing my glasses this morning. I think they're in the bedroom or something. All 2 pairs. Good morning, Irvelyn. But that's okay, because I can actually see my computer screen, because they are kind of big, actually. I can see those perfectly fine. But a lot of times I still have them on. Irvelyn is here. As you guys can hear, my voice is a little bit crackly this morning. I've come down with what seems like a head cold. And so yesterday I wasn't really feeling the best. Like I got up and I was like, ugh. And then I gotta take some medication this morning. I am taking some Tamiflu and stuff for it, which they say will help lessen the duration of whatever it is. And, drinking some tea, because most mornings I'm drinking water. So I am having some tea this morning as well. And this is one of those teacups, my CMR mug, because I had tea last night as well. My CMR mug is in the it's in the sink from last night. But look at this. This is one of those little mugs that when it's hot, you put a photo on it. And when it's hot, the photo shows up. And then when it cools down, it just goes completely black. So that's my little pumpkin. Look at her. That's when she was 2008. She was 2 years old. And man, she's got a lot of curls. Like her hair is really long. It's all the way down her back. But here, I'm trying to see if I can get it to just even, there it is. So here it almost was, there we are. So this is when it was still growing. And I mean, she had some serious curls in there. Curly Sue. So I'm drinking a little bit of tea to soothe my voice. So someone's asking if I've been tested for COVID. Not this weekend, no. I can assure you that the symptoms that they tell you, like loss of smell and all this other kind of stuff, that isn't what this is at all. This is just literally a cold. And it started with a sore throat, as all of my colds do. They always start for me in my throat. And the respiratory symptoms that are quite usual when it comes to COVID are not when I have it all. I don't have anything respiratory. I'm just like, it's almost like just a head cold. It's like my head and throat, and then it just stops there. And that's the end of it. But of course, taking precautions, making sure that even with a cold, I'm not trying to spread that. I am wearing my mask and sanitizing and washing my hands as much as possible, so that hopefully nobody else in my household catches it either. Good morning, Jackie. And good morning, Dawn. How are you? Yes, it's another beautiful day in the Cayman Islands. Richie Rich is here. He says, Celine is back home. Aw, happy wife, happy life. Dawn, did you finally pick up your new mug? He says, my mug is empty. Let's fill it up. James joining us from Canada. We got lots and lots and lots to fill it up with. Good morning to the beautiful Emma. Felicia's here. Siobhan, Patricia. Evelyn says, I don't blame you one bit for not going. Atlas says the protest is for human rights and freedom of choice based on the interviews I watched and the signs they were holding. I don't think it was about anti-vaxxers. Well, Atlas, you and I must not have been seeing the same signs. Now, listen, we played these audio notes last week from different people connected to organizing this event, and they knew, that, they would be attracting certain people. And they even said, oh, let's not distract from the message by, making this about anything else. So don't bring out your anti-vaxxer shirts. Don't talk about it. I mean, they knew that that's exactly what was coming, because they also know that that is what they attract, without a doubt. So I'm going to break it down for you. We've got, I think the HSA folks are going to come in around 8:30ish or so, and they're going to walk us through some bits and pieces of their portal. And listen, I make no apologies for being who I am. Now, people are like, oh, well, I used to like you, and I like when you cover certain things. I don't care. I'm going to be so incredibly frank with you all this morning that, listen, if you can't take the cold hard truth, by all means, please go watch something else. Because if you're going to be insulted, if you're going to be gaslighted, if you're going to be bullied, then this is not the morning for you to be watching my show. Because I'm just not even in the mood. I'm not in the mood to be polite, and I'm not in the mood to be nice about it. So, I want y'all to listen to me very, very carefully. Then I thought, let me just think about that. I think that's always my mood. I am just a no nonsense kind of person, and I don't really care who likes it. Yeah, Dr. T, man, every time that man opens his mouth, I lose more and more respect for him. Like I said, I'm just going to tell you all the cold hard truth. If you don't want it, I feel like I should be putting a little something extra in my tea other than the honey that I have in there right now. If you don't want to listen to it, then you don't really have to. This is the beauty of choices, and there are consequences for everything that we do. I'm so disappointed in him. There are other people in that group that I have absolutely no expectations of, none at all. The Tara Ebankses of the world, do I have an expectation of her? No. Mario Rankin, do I have any expectations of him? Not in this lifetime. Do I believe in reincarnation? No. I don't have any expectations of certain people. Katina, do I have any expectations of her? But there are some people who were there who I just thought I expected more of. So listen, I didn't go. First of all, I had a family event. It's not often that, not a family event, but my husband had something to attend and he requested my presence. And I must say, it's not often that he does stuff that he requests me to be there. Normally it's the other way around. And so when he does ask, I take it very, very seriously, that I should give up of my time, right? Obviously CMR requires a lot of my time. All day yesterday, for example, all day long, I was sitting down writing story after story. As a new school was coming out, positive, 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 we were putting the story together, getting all of the details. So that whilst other newspapers who have, 40, 55, 6, whatever staff members, and we're down to a skeletal crew, especially with poor Renee just having had a baby, I was still making sure that we were bringing it to you as it was happening in real time, and we were on top of it. So that was a priority for me yesterday. On Saturday, my priority was spending some quality time with my family. Yes, Patricia, we've already said that. Ian, hold on to your big boy panties. We're going to get there. And so I make absolutely no apologies for sitting here and telling you guys that I am not in the business of propagating misinformation. In fact, we have gone out of our way to make sure that people have accurate information, not hearsay, and if it is hearsay, we tell you this is hearsay. We don't know if this is true. I spent a lot of time looking at research papers, reading, not for my own good, but trying to inform other people and keep people in the know. Because one of the interesting things I find with this whole pandemic right now, everybody's like, people, the confirmation bias, right, is so amazing to me. But people are like, oh, well, look, we have all these cases, positive cases came out, and look, not a single Caymanian has died. Now, y'all ain't got no sense when you make statements like that. This is a numbers game, okay? We have just begun with any real degree of community transmission. Because before, during the early days of the pandemic, as soon as we had the 1 or 2 cases, the entire country was shut down. And we were able to contain it for months. How long did we actually contain it for? Nobody will ever know. How long have we had these community spread cases? We don't know. We just know that now we know that they're there. And of course, now everybody's being tested in environments where they had not previously been tested before. And so now all these positives in every single school is popping up. So don't tell me foolishness about, nobody's died, as though this pandemic isn't real. This virus isn't real. What's the big deal? Everybody's fine. The day somebody dies and you know that person, that's your family member. That's like, you're going to be like Nicki Minaj. That's my cousin's cousin, friend, 5 times removed, right? Then you're going to be like, oh, you see, now somebody's died and came in, blah, blah, blah. Y'all need to wake the hell up. You all need to wake up and stop the foolishness. So Atlas, when you say to me that you did not see anyone there who was an anti-vaxxer, I'm going to show you some of the signs that, despite the fact that I wasn't there, proved to me that there were people in the crowd who were anti-vaxxers. And furthermore, I actually know some of these people, and I know the stuff that they believe. You don't have to tell me, because unfortunately, They share their beliefs all the time. And some of these people I have stood with in other protests and other platforms. And, when it comes to this particular topic, they have a very different perspective and a very different view. So you can tell me there were no anti-vaxxers there, Atlas, but when I see signs like this saying fake pandemic, real genocide, don't be sheep, I don't know what that word is, something, whatever the rest of her sign says. I choose ivermectin and or hydroxychloroquine over the vaccine. You have got to be kidding me that when you say that there were no anti-vaxxers there. This man is not only an anti-vaxxer, but he says COVID doesn't even exist. We've killed it, according to him. Really? This is the hot mess that y'all mixed up with on Saturday? I'm sorry, but y'all have little to no credibility in my book. This is just beyond anything that I could process in my head. This is absolutely ridiculous, folks. So yes, there were anti-vaxxers there because this type of protest, and I hate to say it, but people who will tend to believe that the vaccine is killing them and, don't want to deal with accurate information, those are the same folks who will sit back and believe anything that they want to believe. They're the same folks who are going to be like, no. There's not such thing as Fauci did this. I mean, the stuff that I've heard from people that are my friends. And I tell you, I only got 5 friends because I don't like a lot of people around me, to be quite frank, right? Because I don't entertain a lot of nonsense. But the stuff that I've heard from people that I care about and that I love and that I consider a real friend has really, really blown my socks off. I mean, literally. In every single study from the onset, we have said this situation with COVID is brand new. It's a brand new virus in so many respects. There was a lot of unknowns, right? We have accepted that even with the vaccine, to a certain degree, there were certain unknowns in terms of how much protection you would get from the vaccine, how long it would last, all of these things. No one has walked in here with a handbook, of the COVID-19 definitive answers, right? It is a process of learning as we go along. So over the weekend, and there have been studies, ongoing trials, ongoing studies. How are people reacting now that over 6 billion people have been vaccinated? How are people reacting to the vaccine? How long is it lasting? Delta came along and that just, yes, my dear. Hey, Junior, we got over 371 people tuned in, just FYI, in case you want to know. How do we even know if the vaccines are working against the Delta variant? Because the Delta variant is a whole new cup of tea, y'all. That ain't the little tea that we trying to drink. That is like the kind of tea that you just supercharge out of this world kind of shit. You know what I'm saying? And so, sorry, there's almost always this element of the unknown. Buenos dias, Elizabeth. And we have accepted that without a doubt. So, but again, y'all don't want to listen. None of that makes a difference. The study is there and we posted it and I see people saying, oh, well, oh yeah, how do we know this is true? How you know it's true? Because in the article, and I always try to do this, I find the source document, the study, link it in the story. You can then click on it and you can go read it for yourself and see the 100,000 people that they use for this survey, larger than the population size of the Cayman Islands. Y'all just want to believe whatever you want to believe, whether it makes any sense or not. And it will cost lives in this country. I feel particularly sorry for the leaders in this country because they're damned if they do and they're damned if they don't. Now, today, they're going to start debating, this situation as it relates to mandating vaccinations for work permit holders. Folks, every place in the world are going to have some level of vaccine mandates. I want y'all to hear me again. You like it or you lump it. This jurisdiction relies on tourism. You think that we can ever reopen our borders and not mandate that tourists have to be vaccinated before they come here? That we need to have a negative PCR test? Are y'all kidding me? We will have to have mandates. We have a 50% imported population into the Cayman Islands, and a large number of those persons are here on work permits. So if we say that they have to be vaccinated, folks, you're getting that much closer to having the level of protection that will mean fewer people in this country will die. Oh, nobody's died yet, Sandy. What's the big deal? The big deal is going to be the second somebody does die. Then y'all are going to be up in this government's behind talking your nonsense and your foolishness. The people in this country are delusional to a level that unfortunately really, really disappoints me. And I make no apologies for the position that I take. So if you think that I'm a biased representative, CMR, good. I am biased. And I've always been biased, right? So when I sit here and I talk about, for example, these child molesters that we have rampant in this country, I see another Jamaican national having sex with his own daughter, 48-year-old man. He should be flogged in the streets of Georgetown. That's a biased statement, y'all. I ain't got no time for child molesters. I personally believe they should all be executed. There you go. That's that's a bias. I'm taking a position. So what? We take positions every single day in life. I'm trying to take a position on the size of science when it comes to COVID-19 and what is going to give our people, the people of the Cayman Islands, a fighting chance. If you want to call that bias and that I don't want to give people spouting misinformation a platform, then go ahead. Call me biased. I don't care. Say that I'm a bully. I care not. Okay? Does that make you feel better? Say that I'm gaslighting you when I tell you the truth. I don't care. It doesn't matter to me. Because the truth in history will vindicate those of us who stood for truth and those of us who spoke for science and who relied on the evidence. And you know what? If the evidence changes tomorrow, I'll be the first one to say, hey, look at the new information that we have out that we have to work with. It's like this whole thing with, does the vaccine give you any degree of protection, right? Against actually spreading it to other people. Because that's a big argument with these anti-vaxxers and pro-choice. They want to call themselves pro-choice, right? And they say, well, you can catch it too and you can spread it. Yeah, you can. And we've always accepted that. No one has ever said anything different. But now we have evidence that even if it's just for 6 months or a year in, your ability to spread it, especially if you have the Pfizer vaccine, which seems to be the most effective with the fewer side effects, 60-something% less likely to spread it. It allows your body to even if you catch COVID, to recover sooner. These things, these numbers, folks, are important. And yes, that is good, solid information. Listen, they're still collecting the data. They're still researching it. There are going to be studies every single day that are going to be coming out, and that is going to be proving X over Y. And I am following the study. I'm going along with it. What I'm not following is your nonsense that don't make no logical sense. Now, I want to speak to something, this concept of discrimination, right? So everyone, of course, is up in their feelings. We're being discriminated against. If you tell us, if I make this choice and I can't do X and Y, I'm being discriminated against. Y'all need to stop it. Kevin, I see you, honey child, but I'm coming. Listen to me. Every single day, you get to make choices in life, right? When you go on a plane after 9/11, you had to be scanned. You had to take off your shoes after they found some guy with it in a bomb in his shoe. You have to subject everything to being scanned. You got to take off your belt, give them your passport, all these new procedures in place, right? You don't follow those procedures, you're not getting on that plane. Is that discrimination? Okay. Remember when the seatbelt law came into effect? Half of y'all didn't want to wear a seatbelt. No, I don't want to wear a seatbelt. I don't care what the science says about it saving my life. I don't want to wear a seatbelt. It's restricting me. I can't breathe. It's hurting my bubbies. It's doing this, it's doing that. Every excuse in the world. But guess what? 99% of y'all buckle up in this day and age. Because you know why? If you don't, there are consequences for not buckling up. There have been so many things that have been thrown at us in life, right? Some major life changes that we have had to adjust to. And folks, you adjust or you deal with the consequences. So now with COVID, the amazing thing is people are all of a sudden up in arms about, this whole, oh, well, if you tell me X, if you're forcing me to do this, that's discrimination. No, honey, it's called choices have consequences. I think, as a matter of fact, Christopher Saunders ran on this platform during the election. Choices have consequences every single day of your life. And if you choose to do certain things, there will be consequences. So hear me and hear me good. If you choose to not get vaccinated, it's not mandated in this country yet, there will be consequences. So if your employer says you don't get vaccinated, you have to wear a mask at work, you have to do a PCR test every week, you have to do X, you have to do Y, then you have a choice. That's the consequence of your first choice. After that, you have another choice. You can either stay in the job and follow their rules, or you can decide to leave your job and go somewhere else. I want to address something, and I feel this to me is personal in a way, because I've gotten to know Izzy more closely over the past 9 months. She actually taught at my daughter's school. She was the music teacher. And I like Izzy a lot as a person, but I also recognize that she has a lot of biases, right? As we all do, first of all. So she believes that your body can fight anything in the world that is thrown at it. If that was the case, we wouldn't need doctors. Let me be very, very frank. I would never have to take an antibiotic in my life if my body was capable of fighting every single thing. I would never in a million years have to take an aspirin. I would never have to go to physiotherapy if my body was capable of fighting off every single thing that happened to it. Right? Now, I'm a person who believes in trying to give your body a fighting chance. And yes, there are lots of things that we can do. Most of us don't do them because, again, every day we're out there making really piss poor choices about our health. So we're not eating well, especially as Caribbean people. We love our food and we love all the wrong kinds of food. Some of y'all are smoking, right? Some of y'all do drugs. You do all kinds of stuff. So you're not exercising. And I look at people who say, oh, yes, your body's immune system, you can fight it. And I look at them and I go, maybe you have a decent diet. I don't know, because I'm not seeing what you eat 24/7. But I'm still looking at you. You're not even someone who exercises, child. And you know the health benefits of exercise and so many fronts. So you think that your body is ready to take on any infection and be optimal in the way that it operates. You're not paying attention. You're not listening to what the science has said. So for example, when we have scientists last week here, doctors who are dealing with COVID, and this is where I want to say to Dr. T, you might be practicing for 1,000 years. I don't care how old you are and how long you've been practicing. You have no experience with COVID. As far as I know, you've never even seen a COVID patient. You have no research experience. You have no real world practical experience, nothing. You are a GP that did a course in OBGYN. When I say I'm sorry, but to me, that doesn't really mean a whole lot. And there are people who unfortunately are sitting back relying on you as an expert. And that hurts my soul. We're not going to talk about anything else about that, Dr. T, because I'm really not trying to disrespect you. But do you have a stellar reputation where I would say, wow, everything he said has always been accurate? Let me put it this way. My professional contact with Dr. T has been very, very limited. But when my father was on his deathbed, I had an interaction with Dr. T. And after having had that interaction, and I'm not going to even repeat what it was, because this is the type of situation that when you lose people that are close to you, and you have to deal with medical professionals that have no effing sense, this is where anything they say after that is beyond suspect. I'm not going to get into the details of it, folks, because trust me, my level of being pissed off this morning is going to go through the roof. He's an expert. An expert in what? Okay? I'm not trying to be rude here. I'm just trying to ask some legit questions that need some answers. So you want to believe him and what he has to say and everything he's put out there, misinformation? Good for you. I know better. A little bit of personal experience and paying a whole lot of attention during this pandemic. I know better. Let's just leave it at that. You know, life takes a whole other element of realness when you can say that you have sat down and see someone take their last breath right in front of you. And I've unfortunately had that twice in my life. Once with someone that I didn't know that fell off a building in Georgetown. And a second time with my own father on his deathbed. And like I said, that was my sole experience with Dr. T. I didn't know really who he was. And I'm guessing back then he probably didn't know who I was either. This was a long time ago. But it doesn't matter, right? These things have an impact on you. And so death is real, right? These things are real. So I like Izzy, but when I hear her say, oh, your body can fight off anything, your body can do a better job than the vaccine. I'm sorry. What experts told you that? We have frontline workers, Izzy. If you never listened to anything that I have said before, I would want you to listen to the frontline workers. We've had them on this program. Talk about how they see people, thousands of people every single day. Tampa General Hospital, whatever facility they're working at. Your body is not fighting this disease. It is killing people all over the world. And yes, you went into a situation, my friend, where you tested an employer to the limit. You told the employer essentially that you're not going to do all of the things that the employer wants you to do. Those are all your choices, but with those choices come consequences. Let's have a look at a few things here, folks.
Got a question for you about when, you are, having those initial conversations with patients that are getting picked up by you and your team. Have you ever heard of anyone who just got vaccinated and they automatically have some sort of adverse reaction?
No, I haven't had any patients that, called to say that they've been vaccinated and then that's the reason why they're calling is because they're having adverse effects from it. I personally have not had anything like that. Generally, it's the opposite. It's that they have COVID and they're not vaccinated and they're really sick. So
And I see Asia shaking her head because, I mean, she's the one that's going to be ultimately receiving some of your patients. And so what's your thoughts on that?
I would have to agree. I mean, sometimes they come in, and when they come into the ED, we always, the emergency department, the emergency department gets a synopsis of the patient's condition prior to arrival. The paramedics and firefighters could be going to the scene and saying, hey, patients requiring oxygen. This is what they look like. We're going to bring them in. But they could get a call 10 minutes en route and say, hey, patients respiratory wise, they're tanking. We're going to intubate them now. So they're going to come in on a ventilator. It happens just that fast. You could be on the scene and a patient is somewhat respiratorily compromised. And while you're en route, they need full respiratory support, including the breathing tube and the ventilator. So sometimes by the time, they get through those doors in the ED, we're now dealing with a completely different scenario, a completely different picture than we did when we EMS initially arrived on scene. So unfortunately, that is kind of how it can go with COVID and why vaccination, again, is so important.
Folks, if COVID was something that your body could fight, if it was a common cold or flu, which when you make a statement like that, that is essentially what you're saying. I could relate to your sentiments of not wanting to take a vaccine. Every single year, the flu vaccine is available, and that saves millions of lives. And I've taken the flu vaccine only twice in my life. Because the chances of me catching a flu that is going to have that level of an impact on me at my age, especially, is relatively slim to none. It's not the same percentage of people all over the world, folks, the millions of people that have now died because of COVID-19 in the space of less than 2 years. So let's watch this video clip.
To this COVID-19 pandemic, in terms of jobs enforcing the vaccination. Mrs. Adore, can you just explain to the public exactly what happened to you recently when your employer asked you to get vaccinated?
Well, the mandates came in a few weeks ago, and so they were encouraging people to get the vaccine. I am not comfortable taking the vaccine because I've done my research and I feel that it's a dangerous thing to take, and I don't want to take it. What everyone else chooses to do is entirely their choice. I'm not taking that choice away from them, but I do have a choice at present. So unfortunately for me, masking doesn't work either because I will pass out after 10 or 15 minutes, and I don't particularly want to be at a desk constantly being resuscitated during the day. So I was offered the option of a face shield. I'm trying to really condense this for you, Andrel, because I know you've got lots of people that you want to speak to. So I had to wear a face shield. Unfortunately, the face shield reflection on it, I couldn't see my screen. So I asked if I could possibly have a like a visor of some sort around my desk, and I offered to actually pay for this visor just so that I could do my job, because I actually really seriously take, I'm a professional and I take a pride in what I do. I didn't even get a response on that. The PCR test would cause me to have nosebleeds because I do have nosebleeds, and I don't know if anyone has investigated the PCR testing, but it actually goes to the cribriform plate, which is the between your blood-brain barrier, and it's a fairly dangerous test to take, especially regularly, and I think Dr. Tomlinson can actually speak on that and has spoken on that, so I'm not taking anything from another source, but him actually, and other sources. And but by the time I said I wasn't prepared to take the PCR test, could I take the option of unpaid leave until this could be resolved? Because we all know at some point the PCR test is not going to be used because the FDA has said by the 31st of December it's no longer valid. I was 3 hours later basically terminated. I was on probation. I was 3 hours later terminated and given 15 minutes to leave the office, as if I had done something really incredibly wrong.
All right. Let me just stop that there for a second, folks. We do have to transition in about 15 minutes to bring our HSA guests in. But let me just try to understand this, because I'm looking at this from the perspective of someone who likes this young lady, who's a friend to Izzy, and I'm still lost and just woefully confused here. Your employer gives you the option: vaccinated, mask, face shield, PCR tests. Every single thing they put to you, you can't do. Oh, I pass out when I wear a mask. There are professional physicians who wear a mask working 16-hour shifts every single day and they're not passing out. I get nosebleeds from a PCR test. I can't wear a face shield because it has reflection on the screen. Listen, I'm an employer, and I can only imagine how these employers were reflecting on this situation. Here's a new hire, still on probation, just been with us a few months. We're in the middle of a pandemic, and we have given you option after option after option, and every single option that we present to you, you have an excuse. Oh, I'm going to be passing out at my desk. Really? And then you want to be able to tell your employer, you're going to dictate to them what you're willing to do. Give me unpaid leave. What employer do you know can hire someone to do a job, and within a couple months of doing the job, that person says, oh, put me on unpaid leave indefinitely until something in the world changes? You see, this is where I know y'all are delusional. And the sad part is Izzy herself has been an employer. She worked in tourism. She's ran a band. She's hired people. And I cannot imagine if she was in a similar position as the employer and she had given her employees all these opportunities to do certain things and they came to her with something like this. Then how about you let me build an enclosure, physically change your office, have construction workers come in here and enclose me in, as though you don't go to the printer, as though you don't walk up and go to the bathroom, but you can't wear a mask. It's like, what the hell are you saying? You see, this is the level of thinking that is out there in the atmosphere, in this country and elsewhere in the world, that is absolutely ridiculous and absolutely crazy. I'm sorry. The employer in this instance had no choice. And I'm sure she's a great worker, and I'm sure that they were sad to even have to do this. Your choices have consequences, folks. She had a lot of choices that she refused, every single one. And then you are surprised when the employer says, get the hell out of here? Don't be surprised. More is coming. I heard of a young man over at Maples Finance who has resigned because he doesn't want to take a PCR test, right? So they said, okay, you don't want to be vaccinated? We're not going to tell you that you have to be vaccinated. No problem. But you're going to take a PCR test every single week. He quit his job, has a baby recently, right? 2 young children and a wife, and you quit your job, good, because there will be consequences for that action. When you have a hungry belly and you're trying to figure out how to pay for daycare for those babies, no one should feel any sympathy for you. If you can find another employer who's like, we're open, we don't care about your status, come on in, whatever, good. I'm sure there's few, I only know of one that's doing it, but I'm sure that in short order, they're going to have so many applications on file from people like you looking to work for them that they're not going to know what to do. Rachel says, unfortunately, she believes a ton of false things. She thinks vaccinated people shed particles, which is just bananas. She's woefully misled by all the disinformation she's been given, and that's sad because she's a nice lady who is now making foolish choices with real consequences. Well, it is what it is. And the only thing I can say, folks, is that I really hope that the same people who are supporting her, right, in this way of thinking, will also support her in her time of need. Y'all need to man up and help each other out. That's what I would expect. You know, if I'm in a situation where, you know, I'm going to believe certain things and I'm supporting this cause and whatever, yes, y'all need to be supporting each other. Kevin, my apologies for having you wait so long. Good morning. How are you?
Good morning. No problem. I'm doing well. Hey, I'm wondering why you're not using a CMR mug to drink your tea this morning.
It's in the sink. I was saying last night that I only have one CMR mug for myself actually, but I've been drinking a lot of tea trying to help with this cold that I've got. So it's actually in the sink. That's why.
Okay. Well, no, I just wanted to make sure that you were able to mention tomorrow's show that we have coming up. And I'm calling out for every single parent, grandparent, and soon-to-be parents to watch the show because we have an infectious disease doctor who is also a pediatrician who's going to be on. And so parents, especially with what's currently going on with a lot of kids testing positive for COVID or teachers or whoever it is, especially in the schools, we're seeing a lot of cases come up. Definitely want people to be on that show because if you have questions, that is an opportunity for you to get your questions answered by someone who's treating children, who is an infectious disease doctor, who studies vaccines, and who's a pediatrician. I mean, it's completely one of the things that you don't always have access to. And so if you are hearing me, please share this information with every single parent, grandparent, and soon to be parent that you know. 7 o'clock tomorrow night, either on YouTube or on this Facebook page on Cayman Mall Road. Please be there.
Yes, thank you so much, Kevin, for that reminder. So again, folks, as you guys know, CMR has been doing a CMR COVID Spotlight series. This is going to be episode number 5. Some real heavy hitters in terms of professionals that are coming on this program. Frontline workers dealing with COVID, physicians and doctors dealing with, epidemiologists, research on COVID. You can't get more frontline than these people. They're not someone who can sit back and say, oh, I've been practicing for 50 years. I've never seen a COVID patient. I've never been to an ICU with a COVID patient. These are people in the trenches. These are the people that you want to be listening to, folks, and you want to be talking to. And Kevin Watler, who lives in Lakeland, Florida, has done a fantastic job in getting all these individuals lined up for us. So, sorry, tomorrow, again, he's got an expert on who, Kevin, remind me of her name?
Yeah, Dr. Claudia Espinoza. She works for USF, University of South Florida, as well as, I'm not sure if people understand how it kind of works in the university system here. A lot of the university professors, they're not just teachers and professors in the college world, they are also practicing physicians within Tampa General Hospital. There's a big partnership. So the two institutions work together. So again, she does see patients as well as she also is a professor, infectious disease doctor. I mean, she is someone that is someone that I've used to reach out to the Hispanic population because originally I believe she's from Colombia, so she speaks Spanish, and so I've used her many times to do outreach campaigns for those who don't speak English, they speak Spanish. And so again, there might be an opportunity, Sandra, I have not spoken to you about it, but if we want to try to put something together for the Spanish-speaking people in the Cayman Islands, I'm certainly open to seeing if I could get that together as well. But either way, we really want everyone to join that show tomorrow night. It's a very important show, very timely show. And so again, I just want to ensure that we push that.
Okay. Yeah. Thanks a lot, Kevin. Folks, trust me when I tell you, you want to have an opportunity. Of course, you can always go back and listen to the programs, but you want to have an opportunity to have your questions answered.
Because one of the things is something might be said on the show, and it might be it might spark a question, and you don't want to miss a chance to be able to have that answered. We don't want to not get to your question. So what Sandra's saying is that you want to try to be there live, but we understand people have busy lives, and it's at 7 o'clock, so it might be putting your children to bed, or you might have other things going on. So understand you might not be able to be there. You could always watch it later on the Cayman Mall Road Facebook page. It is linked. We have a special section with all of those videos right there, as well as on YouTube. If you're not a Facebooker, if you're watching via YouTube, it's also there as well.
Yeah. Thank you, Kevin. And listen, folks, if you're one of those people that have all these theories and ideas, right, and you want to get on the show with the virologist that's coming up, so you fancy yourself a local expert, and you've been putting forward all this misinformation out there, we would love to have you on the show. Test your expert knowledge with someone who's actually an expert and who has the qualifications and the experience to go along with their expert title, and, see for yourselves. You've got to be willing to understand that you are not the expert that you think you are. And there are actually people who are. Kevin, thank you so much.
No problem. And that's a great point before I leave you, Sandra, is, we want other views on there as well.
Yes.
So again,
Come on,
we've
this is the
invited
time to
Dr.
do it.
Tomlinson. Yep, we've
Yeah,
invited
you've
Dr. Tomlinson
invited
to be
Dr.
on that
T.
show.
I think you've invited Katina.
Yes.
Come on, talk to the
Mhm.
experts. They claim they're experts, then they should be able to sit side by side by a virologist.
Absolutely. And we want that open discussion, because ultimately everyone needs to be able to make their informed decisions. And so we're bringing the experts forward. And so we're going to have that right there for you to be able to watch and see and hear from people who are really seeing it firsthand.
Yeah. Thank you so much, Kev. All right, folks. Thank you so much. Ian says experts have been wrong before. They're wrong every single day, honey. But I tell you what, I'd still put my money on an expert any day than someone who isn't an expert being wrong. The chances is a little bit different. It's a matter of degrees here, folks. Now, listen, we've got this beautiful young lady joining us from the HSA. We're going to pick up this conversation and also get an update on what's happening in Honduras. So we don't want this young lady to wait. Let me just shoot back to my emails and grab the link that I'm supposed to be working with this morning. Give me 1 second here. We appreciate her joining us. Give me 1 second. Let me just get my HSA email up and running. Where's my HSA email? I think it was sent on Friday. So let me, oh gosh, you get so many emails every day. Let me just have a quick look. Maybe it was Thursday. Hold on now. HSA. I'll search for it. That makes total sense. And if you're an IT expert, you know that makes sense. All right. So HSA Thursday. Okay. Right. Okay. Okay. So they had emailed me this morning asking if I wanted to send them some details. Unfortunately, we were already on air, honey child. So the young lady that is joining us this morning is Takia. I think I'm pronouncing that right, Smith. She's the HSA marketing officer. And so what we're going to do is we're going to be setting up the portal. Now, young lady, you'll have to tell me if I can send you this in the private chat so that we can set it up. But listen, the reason why I wanted to do this live is because I've had a number of people reach out to me saying, Sandy, I don't know how this portal thing works. I don't understand it. And, I want to see how it's done. So that is the reason why we are doing it in this particular manner. So just give me 1 quick second. Okay, let me just tell you. Oh, sorry. A second here. Okay, so we're gonna just log in here. Okay. Yes, okay, that's fine. Sorry, I'm in the middle of trying to do something else. All right, so let me just bring our guests on screen. Good morning, young lady. Ooh, I can't hear you. Your mic is muted.
Good morning.
There
Can you
you
hear me
are.
now?
How are you?
I'm good. How are you?
I'm good. Let me make sure I've pronounced your name correctly. Is that how you pronounce it?
Yeah, it's Takia. You got it right.
Takia.
First try.
Okay. Well, thank you so much, Takia, for joining us here on Cayman Law Road, The Cold Hard Truth. So we're going to do a little bit of a demonstration this morning on how to use, number one, your online portal. Now, tell us a little bit about this portal and how it works, first of all.
Okay. The My HSA Patient Portal is our electronic health record management system that we use here at the HSA. It's been around for quite some time, over 5 years, and we've been adapting it to suit the changing medical environment. So, of course, now that we have COVID-19, having digital vaccination certificates and access to that information about your testing and your vaccinations would be very important. So we've since added that. With the portal, you can see your health record, your limited health record 24/7. I say limited because it is information that you'd be able to understand without the interpretation of a doctor. So test results, simple test results. You can request appointments with GP and pediatrics. If you have your child added to your account, you can see your child or ward's information on my HSA patient portal as well. You can send a message for your doctors. You can see previous immunizations. You can request prescription refills online as well. And then you can see your test, general lab radiology results, as well as your COVID-19 testing results.
Beautiful. So Soka just sent a message. She said, you coughed and everyone looked at me. My goodness. Take it easy there, folks. Not everybody that coughs in this day and age has COVID. So, young lady, thank you for giving us a rundown and all the wonderful things that the portal can do. I must tell you that I've heard about it, but I've actually never signed up for it. And you said it's been around for 5 years now?
Yes.
Wow.
We've done one or two relaunches to just let the public be informed. But since doing this massive campaign, we've added quite a few users, and people are starting to use it for more than just their results and seeing the benefit of the portal. So we hope that this will be a part of our digital way forward.
Okay. So I saw that Ms. Brooke over in your department there asked for some of my personal details. Can I just send that to you in the chat here?
Sure.
You can use it now. So you want my phone number? What else did you say you wanted? She said
if I get your full name,
phone number and email address. Okay, so I'll send that to you. Child, most people have that anyway, but I'll send that to you. Okay, so how we're going to do this, folks, is we are going to have a look at the portal. So I've just pulled it up here on the screen. So while this young lady has a look at that, let me just go full screen with what the website looks like. So this is the website as part of the HSA, their primary website, right? So it's hsa.ky, our services, patient portal info. So let me just go back to the homepage and see how easy it is to find the portal. Yeah, there it is, my HSA portal. So everybody sees that right there. So you just click on that little tab. Let me just increase the size of this, by the way. Sorry. So you click on a tab, my HSA portal, and then it tells you can take advantage of all of these things. And then if I click this one, it takes me back to that page where I can kind of get started. So now I have the option of logging into my account, and then it says here that the HSA online portal, again, just like this young lady just said, it's going to give you access to all sorts of information. You can communicate with staff at the HSA. So Takia has indicated that this is a very useful tool, and based on what it says it does, I'm like, yeah, I can message my doctors. You know how many times I've wanted to message them? And I was like, oh God, I've got to be able to call them and, get put on hold, see if somebody else can track them down. They're busy, they're in surgery, This option, you just send them a message, and at some point during the day, I'm assuming that they go through their messages and they're able to answer the messages. So this is great. View general lab and radiology written reports, view your immunization records, allergy and health history, refill prescriptions online. Oh, honey child, I need to get with that. Can I tell you that during the pandemic, one of the things that I really appreciated that the HSA did was they introduced the ability to what do you call it now? For you to be able to send your prescriptions on WhatsApp, right? So you can do that. So yeah, I mean, I think that that's fantastic. I've been using the WhatsApp option and no problem. So I guess if I had signed up for the portal, I could certainly be using that as well. All right, young lady, are you ready?
Yeah, I am. So you've sent me your information already. So what
Beautiful.
I've been doing while you've been doing that good review of the website and the page, I'm already starting to issue you your invitation. So you should receive it
There
momentarily.
we go. Thank you, Sean says, and if there are any issues, all you do is email portalinfo@hsa.ky. Okay, so I'm going to get that information by email.
Yes.
Okay.
I've just sent you the invitation, so pretty much any second now.
Okay. So the other thing here is it says COVID-19 digital vaccination records coming to the HSA portal. So this is one of the reasons why we thought it was important now for you guys to see how the portal works, because if you have been vaccinated, you can now access your QR code proving your vaccination status. Is that correct?
Yes.
And you can do that from your phone, which is good. So even if you're traveling to Miami, remember now, traveling to Miami, the only place that you're going to be able to travel to or get into Miami, the only way you can get in is by showing your vaccination status come November. So someone else just mentioned, by the way, as an aside, that apparently New Zealand will now be banning unvaccinated travelers from November the 1st. Good for them. So
and
having this
I just wanted to point out that it's not limited just in the event that you aren't traveling. Sometimes if you want to just have proof for your employer, as we start to need it more in our own spaces, it's going to be the more convenient way to go.
Yes.
We've seen that some gyms here have started to require proof of
Yes.
vaccination. So I would say we have people who say, well, they don't intend to travel right away, but I would say still get it.
Absolutely. And the regulations now require it. The gyms actually check your vaccination status. So I'm just waiting for the email to come in. Let me just have a look here. Okay, so it says the HSA authority invites you to join my HSA. Access the link by clicking on that and then follow the steps outlined in the page. All right, so let's see what we got here. Okay, so I'm gonna do this a couple different ways. So I'm gonna show you the screen, folks, and then sorry. And then when I fill out my information, obviously I'm going to keep my information confidential. So the first screen after you get the invite. Now, if people wanted to get the invite, how do they get to that first step where you've just done what you've done with me?
All right. So as of right now, a registration officer would prompt the invite for you. So we've been doing our public registration campaign. So the same details that you provided to me, which would be your name, your date of birth, your email address, and the last 4 digits of your phone number. You hand that to a registration officer at one of our public registration drives, or at any time you visit the HSA. One of our registration officers can help you. That will be what you would do then. After that, we'll input that into our system, and then we'll trigger that email invitation to you. That's the way the process works as of right now. Online sign up is forthcoming very soon, and I can say that with confidence that we do have online sign up coming soon, because we know that a number of people have traveled overseas since becoming vaccinated, and we want to make sure that we capture those people as well.
Right. Okay, wonderful. So welcome to my HSA, and it's basically just asking you folks to confirm your information. So I'm going to just pull that off the screen for a second, and then I will do that. So again, lots of benefits here to being able to do this. And then you just click on I agree, and you say next to create your account. The information you entered is incorrect. Let me double check what I sent you. Yes, that's what I put in. Oh, my bad. I put in my wrong birth date. Well, that would certainly help, folks, if I actually knew my birth date. Mess with me. All right. So the next screen then just comes up. It says create an account. It has my name, email address. It's just asking me to put my email address back in, date of birth, gender, And now it says username or password. So I'm going to create a username. And then a password. Now, I always make my password particularly difficult.
Which is a good idea because this is your medical health record. It is confidential. You want to make sure that it's kept securely.
So, folks, there are a number of things. This kind of feels like an IT sort of moment for you, but there are a number of options available to you. There are applications. The one that I use is called RoboForm. There's another one called Password something or another. I think my husband uses that one. And it'll auto generate these very difficult to guess encrypted passwords with all sorts of letters and characters and nothing that you'll ever remember. But the good news is it actually saves it and secures it for you so that even when you log in, it will have that information available for you. So I'm going to have that because this is one of those things that I don't want to just put a random password like the dog's name or, you know, your daughter's name or whatever you guys be creating or Kman123. Pick a password that's very, very difficult for anyone to ever get any access to because as this young lady, Takia, has pointed out, this is not the kind of information that you want someone to be accessing. It's your medical records. So then it asks you a security question and answer. I always pick something that's relatively difficult. Sometimes they're so difficult I can't even remember the answers myself. I mean, I can't remember. I'll be like, what did I put again? All right, then I say I agree and create account. So let me see now. And then I'm going to save this so that I can actually get in again because remember now I auto created that password and I don't know anything about it. Oh, good. So that's it?
Yeah, that's it.
Wow. Look at that, folks. So easy peasy. Take advantage of your health. We have a COVID center. Find a doctor. Online refills. So I got to start doing that. Add my child. You've got health records, messaging over here, appointments, patient information. Oh, there's an iOS app.
Yes.
So does that give me a barcode if I click on it?
No, it takes you to the App Store link. So if you access this from your mobile phone, you'll be able to download that app, Health eLife. Persons have been coming to our registration drives and saying, oh, do I have to download the app first? And it doesn't matter either way. We set up your account. You do see that you have an online access to it as well in the event that you don't want to use the app, but you can use both ways. I have both ways just because it's more convenient for me to be able to access it either on a desktop or through my phone.
So it has a little bit of information here on coronavirus disease, get started, any allergies. So I do have an allergy to Percocet. So that's already in there. General information. Ooh, y'all can look at all my test results right now. Yeah, so the last time I was there, latest results was in May. This is interesting because, you know, I was speaking to another physician a couple days ago and she said to me, there's something we were talking about. I can't remember now. And she was like, oh, when was the last time you had, I don't even know what was tested. Did she say thyroid or something? She's like, and when was the last time you had test result? And I was like, it was just a couple months ago, I feel like. And they tested everything under the sun. So, you know, I get at least once or twice a year, very extensive blood work done because there are certain numbers that I'm watching for myself. We were talking earlier about the necessity to take care of yourself and your own health. And yes, I'm overweight, folks. Chunky monkey standing right in front of you. Everybody knows I love my food. And so that puts me at risk for a couple of things, including diabetes. I've got a family history of diabetics in my family on my mother's side. And so, you know, I want to be mindful of those numbers. Although if I was really on top of things, child, I would be exercising and losing some weight. But anyway, I digress. You know, I like to keep track of all these numbers. So this A1C number is actually a really important number. And I'm going to share this with you guys because despite the fact that I'm not diabetic, one of the things that is an indicator that I need to watch myself is this A1C number, because this A1C number gives you an indication of what your blood sugar level is over a 3-month period of time, right? So a lot of diabetics have to take that to see how their sugar is being regulated long term. But even if you're not a diabetic, every once in a while you should get that done, because you go in for a fasting test, and this always happens to me. I go in the morning, I do the fasting test, my sugar is fine in that moment in time. But the long term indicators for me is that my body is not regulating my sugar as well as it should be. So I'm not a diabetic yet, but this number is high. And I think it's, I'm trying to remember how, it's not the level yet where they're like, let me see, A1C numbers. Yeah, so we've got a chart here that'll tell us what's in the range, sort of what's normal and what you want to be looking out for. So it's not in the, like the, let me just see here, A1C. So optimal is, well, it depends on a number of different things, but they have a whole chart here that says like pre-diabetes, optimal. So anything I think above, I want to say above a 5, I'll have to double check this though, is where they don't want you to be, right? So 5.7, so up to 5.6 is normal. 5.7 and up for your A1C number is where they start to tell you you need to watch yourself, because that's considered pre-diabetes. So mine is a 6.1. So, I want to try to bring that number down, but this is fantastic because this tells you everything. So you see my glucose level on that same day, I took it and it was in the normal range, more or less, I think. So listen, this will give you all sorts of information. Generally speaking, I'm like relatively healthy, but there are definitely some tweaks that I can do. And it's good that this information is available to you. So say, for example, now I call Dr. Pomares and I say, oh, doc, I want to come and see you. Not feeling too well, blah, blah, blah. And she says, okay, what are your lab results from last time? Instead of me wasting days now trying to message the poor HSA staff, they're busy, they're inundated with requests, whatever. Correct me if I'm wrong, young lady, but I could just go in here. Can I print anything out of here, like reports and stuff?
You can, you should be able to, and it'll just the same way you print a regular web page, you should be able to print this view.
Okay, so see, I can just give her this information. I can read it off. I can look it up on the app on my phone. So this is the benefit, folks, of having, this available to you. Now, where do I go for my COVID stuff? Do I go to COVID Center?
Yeah, so COVID Center is that tab right there at the top.
Right.
That'll take you to your last testing. So you'll see your last COVID-19 laboratory results, the second column on the bottom. But then
that was when I got tested. Okay.
Yeah, so it'll show that you were non-detected. And
so
then
all of these people now who are being tested as part of like the schools and so forth, if they had access to the HSA portal, they could go on here and check their test results once they're uploaded?
Yes, and I do believe that they are automatically registered to receive those results on the portal as well.
So they just need to register for the portal. Oh, nice.
Yes.
So yes, folks, as of September the 9th, I'm COVID free. Now, how do I view vaccination verification?
Yes.
So this is the part now that we want to get verified.
Yes, and I would not share this part. It is your private QR code that's going to come up.
Okay. All right. Thank you for that. So I will not be sharing that bit. But would my code already be in there?
Yes.
Oh, snaps. So it actually tells me the days that I got vaccinated. Let me see if I can just screen grab this for a second. So I guess nothing's particularly, and I can print a card. Oh yeah, that's what.
Yeah. And if you're accessing this on your mobile, you can take a screenshot of it as well, and just save it to your photos so you can
and
easily
just save
access
it. Okay. Yes, honey child, this looks nice. All right, folks. So it will actually tell you what dates you got the vaccine. So here I am. My first one was May the 29th, the lot number and everything. And then my second one was June the 25th. There we go, folks. So all of your information, the QR code is already in there, and boom, that's as easy as that. That's it.
Yep.
That was easy. Anything else we need to know about the online portal? I can view upcoming appointments. I can also request an appointment.
Yes, you can use the portal to request appointments with GP and pediatrics.
GP and
pediatrics, if you want to add your child.
But anything like physio or anything like that, that's different.
Yeah, that's different because it's considered a specialist appointment. But those are easy to book as well in the traditional methods. The Smart Health cards, your COVID-19 digital vaccine certificate, it's built using Common Pass. So it's a widely accepted platform that we've used to create this. And also it's compatible with Apple Health if you have iOS 15.
Okay. So Anne says you have to have a fairly new phone to download the health. What is it called? Healthy Life
app. For those persons, I would recommend the URL that the MyHSA URL is great to use if you have an older phone in the event that you cannot access the
app. Sorry. Let me see here now. So I see health. Yep. And the icon matches. So I can download that. Very good. And it says double click to install. All right. I'm on my way. I'm going to have that on my phone here shortly. That's fantastic. And you said it integrates with the iPhone, like their
Apple
medical
Health,
app, whatever that's called.
Yeah, with iOS 15, obviously has been built to adapt to the current pandemic environment. So Smart Health cards are recognized.
Wow, this is fantastic. Big shout out, folks, to the HSA and their team who have put this together. I know this is a lot of work on the IT side of things, y'all. This is quite good. Glad to see that this is available to people. Good morning, Damaris. So folks, go ahead and contact the HSA. Get your online access to the HSA portal. Lots of useful information there. I'm so glad that we had a few minutes with you this morning to do this. We appreciate it. Anything else that you'd like to tell us, Takia?
Well, one last thing. In the event that you live somewhere where the Healthy Life app is not available, that website is a good alternative. So you log on to hsa.ky and you look for that nice, beautiful My HSA logo, and it'll take you to everywhere you need to go. Right. If you have questions, if you've already downloaded the app and you have questions about your COVID-19 vaccine certificate, you can email us at portalinfo@hsa.ky.
And Sean reminds us, is it Sean or Sheen? I think it's Sheen. Reminds us that another one that you can use for your auto passwords is Dashlane and 1Password. I think maybe the 1Password is the one that Marlon uses. I have used RoboForm for eons, like years, and it's just really good. And it's, it just does what it needs to do, which is give you Common Pass. Was it Common Pass? Yes, that is another app. So there's a few of them out there, folks, that are like password savers, and they auto-generate passwords and stuff for you. Even your iPhone will now do that because password protection. You don't want to be using the same password for everything and something that is easily compromised. And if you use your like an email password, you're using it for this, so if somebody cracks your email, they can get into your entire life. You definitely do not want to do that. So, yeah, that's it. How easy was that?
Yeah,
super
and one
easy.
last thing.
Yes,
one last thing is that you can only see your testing results from HSA on this portal. Obviously, we'd only have access to those records that come from us. So if you got PCR testing from one of the fellow hospitals, Doctors Hospital or Health City, you won't see those test results on this portal.
Okay. All right. Thank you so much.
All right. Thank you.
We appreciate it, my dear.
All right.
Have a good one.
You too. Bye.
All right. So we got some breaking news here for you as it relates to the mandatory vaccinations in protecting our borders. We're going to bring that here in a second. Thank you, Miss Anne, and everybody else who's remained with us. Listen, we're giving you guys practical advice. We're waiting on the young man from Honduras as well. He said that he'll be ready here in a jiffy to join us. So someone had questioned, So how are all of those not wanting to be vaccinated going to travel to the US after November? Because you know, Cayman love to jump on a plane to go to Miami in a minute. Child, I'm waiting for it. Okay, so yes, absolutely. All right, folks. Let me just see what else we've got. So we've got some very interesting messages here. Can you ask her? I signed up, but when I try to sign in, it keeps telling me wrong password. Oh, I think that you probably need to do a password reset, maybe. Listen, this is why I don't even be trying to remember my passwords, child, because half the time you be getting them wrong anyway, right? And then you're in a hot mess. I'll email them for you, honey, about resetting that password. All right, so All right, so while we're waiting on Sean to join us from Honduras, Banaka, sorry, let us go ahead and yes, big up to the HSA for real. Let's go ahead and read a few messages that I've received. You guys are not gonna believe this. Okay, so the first message in, and again, big shout out. We're actually live on Twitter this morning. Now, I gotta be honest with y'all. I have never seen a live event on Twitter, so I don't even know exactly how it works. In terms of how you live stream to Twitter, but we know it's possible. And apparently we're there. So if you're on Twitter and you want to check it out, do let me know how that works. Okay, Sean, are you ready? We're ready to bring you in. I'll read some of these other comments perhaps after we get an update from Sean about what is happening in Banaka this morning. Sean, good morning. Are you there?
Morning, I'm Sandy. You could see me?
No, I can't. I see
Okay,
a black
I'm having
screen
some
right
issue.
now.
I touched something. Hold on just a second, please.
Okay, no problem. You probably touched on that one that says stop camera.
Probably that's what I did. Yeah, hold on.
Yeah.
Let's see. Camera. What the hell I did? Let me go back over this.
Okay, baby, no problem. So I still have some tea left, but you know, once the tea gets cold, it's not soothing my throat anymore. So I might as well drink nice water that's already cold. Good morning, good morning, good morning. Who we got here? Alex says very nice. Yes, thank you, Alex. Charles says I've signed up almost a week ago and haven't received an email for my setup as yet. Oh, Charles, DM me your contact details and we'll get you sorted out. Alice, good morning. Okay, Senor Sean, good morning.
Good morning, Sandy. How are you?
I'm good. How are you?
Oh, fine, I would say.
Yes. Tell us a little bit about what's going on there in Banaka, aka Guanaja and Banaka.
Guanaja is the same as saying Banaka. You know, we as locals, islanders that are native from here born, we refer as here as Banaka. You know, the English speaking people says Banaka, but it's the same as saying Guanaja. Okay, what happened, the incident that happened that it was around 2 something. I know I was informed till around 3 o'clock, and it was 2 and something that this incident happened. And according to the source, some are saying from candlelight and some are saying from other issues, but really to be honest, I wouldn't know exactly what caused it to be. You know, they're just rumors, not specific that, you know, have been studied that to say definitely what caused the fire. But it started from a small little house, like around, not directly in the middle on the east side of the Kia Guanaja. That's where it started. So
Can I just pause you for a second there, Sean? Do you have any connections to Cayman personally? Do you have family here?
well, yes, we have connection. All the islanders mostly. The Bodden will be
Yeah.
our connection from.
Right. So
I
there's a
assume,
lot of Bodens there. Because
yeah,
you
yeah.
just said something about Erekle, and that is totally something that like Caymanians would say, right?
Yeah. Our how you say accent and everything is practically like the Caymanian and thing. We have no different. There's certain things that there's differences in communicating wise and thing, but for me it's
We're all
almost
one
the
big
same.
family.
Yeah, all family, all link up one way or the other.
Yeah.
My family would be the Bodden
Basically,
side.
there's some degree of uncertainty about how it started. Because listen, by Saturday morning, as we were receiving the pictures of the fire and everything was still blazing, even there were rumors that this woman started it and she's a crackhead and this and that. And you're saying, listen, those are just rumors. We don't know for sure how it got started. We have an idea of the house in the general area that it started in. And then help us understand, Sean, how did it spread so quickly? It was like, boom.
Yeah, boom. Like what I said, just rumors, speculation, and thing. Because I personally can't say directly. Are you there? That was her or thing, because you'll have to see definitely a person, but it came from where she was living. Obviously, she's a drug addict. Yeah, she is, right? But it could be from a candlelight also, or other items that they're using in that, or I don't know if it was electrical. I don't even know if she had electricity. According to what I heard, no, she didn't have electricity. So, but it was there in where she was living.
Mm-hmm.
Yeah. What else are you asking?
So, how many homes, Sean, have been devastated by this fire?
Okay, destroy. That's the area of Fire Point, and Vietnam. That is when Fire Point is practically destroyed. You could count what house survived there.
Wow.
There and Vietnam the same. So it's around 135 or 120, 26, something like that I'm hearing. Around that number, 125 to 136, something like that. That's what I'm informed of. Yeah.
Wow.
So it's a lot of people that is stayed homeless. People that is from very poor, living in smaller places and all of that, because the Key of Banaka is something that is built with little homes, mostly small homes, each one practically touching each other. That's how it is on the Key. Practically no space for nothing. You just have the little main road, but all the houses are so compact. That's why the fire was so devastating. It started there. Normally, when we have a fire, we could not say professional on out in fires and thing, but when I heard about it, when my wife wake me up, that was wrong that time. I said, that would be out, because normally we have so much how incident in certain years of fire and have been out so very fast.
Yeah.
And where this one was located had access to the water, and I was assuming it would be out. Then further on, you just see spreading. It went more to the west, and then just keep going around, spread.
Yes. Wow. So I just want to show a video here, which you posted. Sorry, 21 hours ago. That just demonstrates, what we're talking about in terms of the devastation there in the area. I've muted it, but tell us a little bit about what we're looking at. Oh my God.
Yeah.
What's left of people's homes.
Yeah, that was yesterday. That's right there in Fire Point. Actually the video, I was doing a whole video that I started from actually we're behind, but my phone went hot on me. So I continue there with the videos on the second part. But that's right at Fire Point. You see how it is destroyed, and it's gone right up to Vietnam. Completely destroyed.
Wow. And most of these homes are concrete homes?
No, not most of them. Most of them is wooden house. Where that we live here, most is wooden house. The concrete that you see there, that there's the one that that is was out of concrete, but most are wooden.
Most are wooden.
Yeah.
And a lot of zinc roofs looks like still.
And a lot of zinc roof, small
Yeah.
little homes, small homes
Yeah.
and things.
And they also seem to be very close together, which
Extremely
I'm assuming
close. You could practically
reach
touch
out
your
and
neighbor,
touch.
reach out and touch your neighbor, listen to your neighbor conversation. Extremely close.
Wow.
That's a bill, yeah.
And
Let's small roofs.
on the key, you have about 10,000 people that live there?
Average, no, Guanaja itself population is about 10,000 Guanaja. So the key, I would give approximately of probably about 6,000 people.
Oh,
Because that's the mean what you say district of Banaka.
Oh, I see. Okay. So Guanaja or Banaka is connected to the mainland, and then you have the key, which goes by the same name that's right off the mainland.
Yeah, okay, yeah, that's like where I live on the island, right?
Yeah.
And that's the key that the fire happened, where the fire happened.
Yeah.
On the key. So
Okay.
that would be the key, where we refers local here refers that as the key. So
Wow.
that's the we'll say the main district of Banaka, where you go and do your business as banking, other stores, shopping, and all of that.
Wow. I mean, this is devastating, really. Oh my
Yeah,
God.
it is. Yeah, as you could see in the video there. And that is like I'm far up from other part that I don't had display early part in one of the videos. Yeah. So right there,
125 or more homes. How many people do you think that's impacting between like children, elderly? Like how many people would you say in total?
how many in total? I really don't know the amount, but if it's 125, approximately 125, you could probably calculate
Maybe 4 people in each home.
4 to 5 people for each home, because the
Yeah.
way we live down here, mostly everybody, the family lives right in one house.
Yes.
Yeah,
Oh
so
my
that'll be
God.
average about 4 to 5 person for each home.
Oh my God, it's horrible.
Yeah,
So
it
what
is.
are some of the what are some of the needs I saw on Saturday that right away
Well, it's
had
the basic needs, but I think the essential needs will be material to
to
rebuild.
rebuild? Yes. Because I know some people right now are trying to get donations together that they're going to be sending stuff to Honduras. Now, one of the things that we have learned from the Red Cross in the past is that a lot of times when natural disasters happen, whether it's like this situation with a fire, or hurricane, or whatever, people in Cayman, for example, go through their closets and they think, oh yeah, let me clear out clothes and send church clothes and all this kind of stuff. Those types of things are not going to be particularly beneficial right now to the people in Guanaja.
Right, I agree, totally agree.
So we need to be organizing efforts
to reconstruct.
Because these are homes that need to be rebuilt from the ground up.
Right. That's the essential thing, the rebuild. Because like I said, mostly I would say the 90% of the people that lost their house, or maybe even more, are people from very poor people. No homes with insurance. Starting from there, probably out of them 125 or 35 homes, you maybe could count if you get to 10 that has insurance, that have been insurance, if you get to that amount.
Yeah. Okay. Wow. Unbelievable.
Yeah.
And are materials readily available there on the island, or they would have to come from the mainland? I'm guessing it doesn't make sense to send materials from Cayman.
No, it wouldn't make sense. It would not make no sense. That would be I would say not a good idea. But all materials has to become like from the mainland, because that you're talking about rebuild back and thing, which they'll have to do some other issues before the rebuilding start.
Yeah, because they have to clean up all of this.
Clean up and do what is plumbing and all of that. Probably improve that much better than what it was before, because it was over here not as practically done the right way. In that sense, so they could focus on improving that. What would be plumbing, sewerage, and other stuff, that to make it as a better place.
Wow, this is quite something.
Yeah.
Oh my gosh, unbelievable.
That's in the area yet not right there.
Well, my dear, thank you so much for joining us this morning and, just notifying us of what's happening, what's update. So Mona's saying, if money is what people need in order to purchase building materials. Now, I know that a GoFundMe page has been set up. I think the Red Cross is also going to be working closely with the Red Cross in Honduras. So we will be notifying people of what resources are available to them to be able to help out. So I know you had posted on your page, one of the
Yeah, right.
GoFundMe pages.
Yeah, it's,
Of course, the concern is always that the funds and the rebuilding effort gets to the people who need it
definitely. Right.
the most,
That has
because,
to be coordinated quite well,
in
because in
situations like
situation
this,
people,
these things.
abuses certain people, that didn't lose anything will want just jump in there and
Exactly.
run
And
the
this is
show.
what I
or
said, I've
abuse it.
got a cousin here. He said, people could drop off stuff at his house that then they would package on to Honduras. And I said, I want people to be very, very careful, because if you undertake those efforts, even if you do your part and then it gets to Honduras and somebody else takes it over, you don't know what's going to happen
But
to it.
I think no, they're coordinated, right? Which is the suggestion we give to the municipality to issue an identification to all the people that lost, that they could just go when there's anything that they help as donation wise come in, that they have an ID or something that they could claim, as a person that was affected in the disaster. So that we will again advise them to do that. That will be a great idea that was suggested by Sheila Henry about that. And I think that it's awesome, how an identification issue for all the loss, and like that you'll know exactly how many people that was affected.
Wow. Okay. All right, my dear. Thank you so much. Appreciate the additional information. Oh, the GoFundMe link. I will send it. Let me just see. I think I have it on your page, Sean. So I'm gonna just go back to your page.
Sure.
And yes, I will share this GoFundMe page. I don't know if there's more than one that has been set up.
Yeah, it's more than one. I can look up the next one. I'll send that to you board also. One that is created by Kina Hila, sister Ria. I think her name is. Yeah, that is created. That is you could trust her also.
Okay, my dear. All right. Well, our condolences to the situation. Thankfully, there was no loss of life, which is amazing.
No loss of life. He had some injured in that, but that was all intoxicated from the smoke.
Oh my gosh.
One that got burned, but otherwise, no death or anything.
Oh my gosh. Well, thank you so much. We really appreciate you keeping us in the loop. And maybe we'll check in with you periodically just to see how the rebuilding process is going.
No problem. We'll be here available anytime, Sandy. Thank you also.
And the person who, let me just see if this person, I just saw a message come in. They wanted an update on the person who was burned. Do you have any information?
I really don't know how much information, but it was Cedro Bustillo. That's the information I got. Cedro Bustillo, and few other guys that was intoxicated. But the one that I understood was burned was Cedro Bustillo, which I think they'll carry him on to Tegucigalpa. He was sent to Tegucigalpa. Him and 2 or 3 other guys that was intoxicated, got badly intoxicated from the smoke.
Okay.
Yeah.
All right, my dear. Thank you so much, Sean. Glad you could hear us today.
I could hear you with the iPhone, but without that, low wise, I don't know what was the issue with my phone.
Yeah, no problem. All right, my dear, stay positive and just know that the people of the Cayman Islands are thinking about you, and we're going to help in any way that we can.
I really appreciate that. Thanks a lot, Sandy. And thanks for having us.
Have a
on
good
the show.
one.
Thanks you too. Bye-bye.
All right, bye-bye. All right, that's Mr. Sean Holder from Guanaja, Banaca, Honduras. Again, thank you so much for joining us this morning. He's provided some useful information, and a few people have provided. I'm still trying to visualize. I've never been to this part of Honduras, so I am trying to visualize it. And someone has sent me a map that is very, very useful to see how it's laid out. So they said this here is the key that we see there. Thank you so much. Rima Haylock has also started a GoFundMe page. Emma, if you have the link for that, let us know. But there's the There's the key there, and there's Guanaja. So it's right off of the coast there. And I'm guessing the other smaller ones are those. They said that one is Rotan. Where's Rotan? And then one is Utila. So those three closest to each other, like Rotan, Utila. How big is Guanaja? Is that like the size of Cayman? I don't know. Like, how does it compare to size, like landmass size? But I think the difference there is the island is highly compacted in terms of residents and homes. This person says no, they're just really small keys. Okay. Oops, let me see here now. That is only Guanaja. Oh, okay. All right. Thank you for the information. Somebody also sent me Google's map, which is useful to kind of see where things are laid out. It's important. Thank God for Google's map, huh? There'd be so many things that you can't even visualize without the help of something like this. But here it is. There's Guanaja, and then I guess this is the key here. How many people does Honduras have? 16 million? Oh no, that's the latitude, I think. I don't know what's the population of Honduras overall. Sorry. So, so these are other keys like around on this side as well. How many keys are there? Do we know? There's Sandy Bay. I've heard of that before. There's El Bite. There's Guanaja. Oh, yes. when you really get in here now, you see, oh gosh, Google Maps shows you everything, kind of chill. Let's have a look. So this is Graham's Place, Guanaja. Is this this is the island here? This is the key? This is it here? I think that's it, you know. This one is Wilmot Bay Gas Station. Let me see now. Pond Key Hotel. What is that hotel? What? Nunbar Rock, Guanaja, Honduras. So they're calling this whole area Guanaja, but where's the key? I think I just lost it. Oh, yes. So this would be it here. Ah, okay. Wow, this is a lot of homes for such a tiny little key. My God. So, wow, this is highly dense. My goodness. Whoa. For such a small little place. So I think the area, there's mango tree. Oh, they have a mango tree as well. Bonaca Novedades Reyes. That's a boutique. So what area? I'm just trying to see exactly where the fire started. There's an ATM at a bank. Did it start down in this lower region here? That's a Baptist church, I think. Pizza House and Bar and Grill. So there's a little mini store, Miss Chula's. Chula? Somebody else asking for the HSA link. I'll send that to you here in a second. So Alexander Store. Yes, this is, I mean, it's a small piece of land, but geez and peace. I mean, the houses are literally on top of each other. Of course, this is, yeah, that creates a very dangerous situation. So where's the other, this is Pond Key. Where's the other ones? Where is Utila and the other ones? Okay. Oh, someone says if you zoom in, there are tons of keys, about 20 between all islands. It's the back left side. It's where it was burned down. It can be walked in about 15 minutes. Oh. Guanaja. Oh. So where are the rest of the keys? Is it over here? This is what does that one say? Something key. There's another key right there. But it doesn't look like most of the keys are inhabited, right? Half Moon Key. Zoom out for all the other islands. Okay, let me see. I'm trying to find Utila and Guanaja. Oh, wait a minute. Okay. Sorry. Oh my gosh. Okay, now I see what's going on. So there's Jamaica, there's Cayman. Aha. So we have Honduras is here. There's Saiba. Right. There's Utila. Okay. I see. Aha. So on the mainland, we have La Saiba, El Pino. Is this still Honduras over on this side? Where's the border? Okay, so then we have West Bay. They have a West Bay too? No, sir. I hear you there. Look like Cayman. We just copied and pasted all sorts of stuff. We copied and pasted West Bay, West End. Isn't there a West End in Cayman Brac? There's Utila. Los Caitos, Pumpkin Hill Beach, Flowers Bay, Sandy Bay, Church of God right there, Camp Bay, Pigeon Cay Beach. Okay. And where's Rotan? So all of these are like little keys over to the side here as well. That's Belize on that side. So Honduras is here in between Nicaragua, El Salvador, Guatemala, and Belize on that side. All right, folks. Good stuff. Thank you so much to our astute. So the Bay Islands is much bigger. Yes, I think I need to play around with this map a little bit more to see exactly where it's at. Child, Cayman is just a little dot. I gotta tell you, Cayman is just a little dot on the map. And they're all scattered. Yes. Thank you, Emma. So, folks, you're gonna hear first this morning. Somebody said just past anti-vax protests, 0 social distancing, and lots not wearing a mask. Oh, child, I can't be bothered with them. Half of them don't even believe that COVID exists, so I don't know what to tell you. But let me show you something here. So we have a letter from Mr. Wayne Panton. So we want to spend some time reading that this morning before the show ends. So let's get in it, folks. Let's see what is going on this morning. Now, someone has made the comment that now we officially see how the politically driven agenda is being played out for the PPM, who finds themselves now in the opposition. It was never about vaccinations or a national plan for reopening. It's about using a national public health issue and global pandemic for purely political purposes to attempt to destabilize the PAC government. Well, is that a is that a, what do you call it? Is that shocking to anyone that the PPM is playing politics? Of course, they never had a plan. You know what I'm saying? Never in a million years. And you mean to tell me that they actually would have opened our borders without any level of vaccination? Mandatory vaccination? Don't make these people lie to y'all. This show is called The Cold Hard Truth for a reason. Yes, Deep Blue Sea. You got that right. Let me read a few comments that came in. So this person says the minority are very loud, and that's okay. Our premier is making decisions for the best of our country and our people. The minority have the freedom of choice, but, and they keep ignoring this, every choice has consequence. If they choose not to be vaccinated, and the consequence is that they will have to seek employment elsewhere. And let me just pause right there. For most employers, that is not even the consequence. For most employers, it's like you can keep your job if you choose not to get vaccinated, but you're going to be PCR tested every single week. You're going to have to wear a mask. You're going to have to do X, Y, Z. And they don't want to do any of it. They're saying, no, 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 no. We make a choice and we don't want any consequences. Y'all go tell that to America. Go to the American border and try to get into Miami after November 1st without being vaccinated. Let me continue reading what this person said. For Caymanians who want the choice, the consequence is that they will have to abstain from doing activities they enjoy, as more and more establishments require proof of vaccination. Gyms, spinning classes, cinema, physiotherapists, attorneys, employers, etc. It is ultimately their choice. Be vaccinated and enjoy the amenities of the Cayman Islands, or choose not to be vaccinated and stop complaining about restrictions placed on them by companies and employers. If there is a way to tell persons who choose not to be vaccinated that they cannot attend the hospital if they get COVID, that would be great. If they don't believe in science to protect them, why should they not be allowed to have science cure them? As we now have community transmission and we're learning to live with COVID, it may be that our borders will reopen sooner than expected. I don't have the answers, but I do have a lot of suggestions, laughing out loud. Those who choose to remain unvaccinated are putting our entire community and our limited healthcare system at risk. And that choice must have a consequence. Happy for you to post, but please don't use my name. No problem, honey. Another person sent the following, which I'm a little bit shocked at. Sorry. Let me show this one. I think this is it. Okay. So this person messaged and said, "Hi, Sandy. FYI, my helper's leaving the island because she doesn't want to get vaccinated." And I said, "Morning. Choices. Where's she from? I'm just curious." Later on, they say Jamaica. Today, she informed me that she was offered an opportunity to purchase a vaccine card for $3,000 KYD. This is very disturbing. The only thing I can say about this, listen, if she chooses to leave, then that's on her. No big deal. She can certainly leave. Good luck to you. At Jamaica, when you get there, you'll see exactly what a hot mess that they're in. But the fact that she potentially can purchase a vaccine card in this country, I really, really hope. And this is why you see our HSA is being so careful. They're not, sorry, they're not going to be accepting vaccinations that they cannot verify from some of y'all, because I don't give a hoots if you're from America, if you're from Jamaica, Honduras, anywhere else in the world. We know that a lot of people are well versed at creating, fake vaccine documentation. And so, if that is something that can be easily done, then of course they're going to pay $3,000. First of all, listen to me. If you don't want to get vaccinated, you say that's your choice. Why are you going to pay for a fake card? Honestly, Why on earth would you be paying for a fake card? Stand by your beliefs. You know? What a hot mess. Someone is sending me a message, but it's hard to read. This is a lot. Oh God. So Alden is on his high horse. Let me show you guys some of the comments that he is sending in some of these groups. He apparently joined an anti-vaxxer group a couple days ago. I've been receiving that. Hold on one second. All right, so let me just see here what Alden has to say. So he is saying, amongst other things, y'all need to go back and listen to his videos, you know. Saying that we must learn to live with COVID-19 is saying we must learn to live with polio or smallpox. Until we're able to vaccinate all demographics in our population, we're playing Russian roulette with a laissez-faire approach to the threat the virus poses. So let's be very, very clear. The man is telling you to get vaccinated, although he's playing with terminologies here. When we say that we have to live with COVID, Alden McLaughlin, please pay attention and please listen ever so carefully. When we say that we have to live with COVID, what we are actually saying, my friend, is that even if you're vaccinated, that does not give you 100% protection. So yes, there's going to be breakthrough infections. There's going to be people who still get it. And that means that you're going to have to live with it regardless of whether you're vaccinated or not. That's what the term means, living to COVID. You're going to stop to wear masks. You're going to stop to... Alden, get your life together. So here we are again. There's Alden, because the quick tests are notoriously unreliable. Oh, he has the most to say. And this person, Joanna Boxall, says, and yet lateral flow tests are used by millions in the UK. Now he says, frankly, England is not the best example of a country that has successfully navigated this pandemic. That's so funny, because when you were in power, you were following the advice of Public Health England. Oh, he's saying the political decisions. What a hot mess. Oh, God. Alden, really? Why didn't you give this government the exact same courtesy that you were afforded? Allow them to make decisions, just like the last opposition supported you. There's a lot of shit you were doing that they didn't agree with. But guess what? Look ya. Look at this. The master manipulates his puppet. My goodness. Get your hand out that man, Bonky. Sure. What a hot mess. Really? Let's read his statement. Soka, this isn't a persistent cough when you have a cold. This is quite normal. And it's actually being agitated by the fact that I'm constantly talking. Another day or so, I'm sure I'll be fine, child. But the show must go on. The office of the leader of the opposition. Here we go, puppet master. This was sent out, I guess, late yesterday. On behalf of the members of the opposition, I write to advise that we have serious concerns about the above bills. As such, we ask the government urgently to consider withdrawing the bills when Parliament meets tomorrow. Oh, my God. We've had concerns regarding these bills since they were published, and it became apparent how far-reaching they are, far beyond the scope of only work permit holders. Our concerns include, but are not limited to, bills that far-reaching deserve. Hold on a second. You don't want to talk about far-reaching? Do we need to remind you all of how far-reaching this same government, Alden, the previous government, how far-reaching they went? Lawyers were planning on suing them for locking you people down, saying that that went against their rights. And what did the premier at that time say? He will do what it takes. He will do what it takes. Doesn't matter. He's going to lock y'all down. And now they want to say that, oh, this is too far reaching. Oh my gosh. Wow. Well, this is not surprising, folks. The government has got to take a position for what's going to benefit the vast majority of people. And like other jurisdictions, whether it's the US, now New Zealand, other places that have joined the vaccine mandates, they're going to have to make it happen. What a mess. So they're saying that the application to non-nationals only appears to be unprecedented anywhere and breach a number of fundamental rights protected by both the Bill of Rights and Responsibilities. Really? There are a lot of things that are for non-nationals only. Like when you apply for a work permit, a non-national who's applying for a work permit has to get a medical health certificate, and they have to include it in that, demonstrate their HIV status. That's not something a Caymanian ever has to do, because a Caymanian doesn't have to get a work permit. So there are long established precedents for this, both in this jurisdiction. This is just my opinion as a non-lawyer. Let me make it very, very clear. There is lots of, sorry, precedents for this in this jurisdiction and elsewhere. Someone replying to Alden's saying that we must learn to live with COVID, they said, talk about hypocrisy. What a hot mess. Wow. Ay. Y'all need to just believe me when I tell you that people are playing politics and they're seeking attention. Someone mentioned earlier that one of the protesters, their whole thing is that they have not been consulted by this government and they want to feel important. Y'all need to get out of your own way. Like, seriously, you really need to get out of your own way, because at this stage, it's just gotten a little bit ridiculous, to say the least. Absolutely ridiculous. Wow. All right. So New Zealand, sorry, has announced that they will ban all vaccinated travelers from November the 1st. Good for New Zealand. Full COVID vaccination, a requirement of entry. They're still going to do 14 days of quarantine. That will remain their first line of defense. All international travelers will have to show negative COVID-19 tests taken within 72 hours of their flight. Mandates, vaccination mandates around the world. Let me just tell you who else has a vaccine mandates worldwide. The list continues to grow by the day because this is the norm during a pandemic. We have, as of September the 16th, let me see what we got here. Greece, Canada, France has some sort of mandate. Indonesia, that's coming in February. Let me see here. United States of America. Just trying to see if there's a more updated list. Britain. So vaccination is required in Britain for home care workers. So again, you know, a category. Just because you single out a category, that in and of itself doesn't make it discriminatory. I don't know why y'all think that. I mean, y'all need to read up on human rights a little bit more. Italy, Russia, Saudi Arabia, Hungary, Turkmenistan, Lebanon. The list goes on. Anyway, folks, thank you so much for tuning in. Gyro says one thing people don't understand is that the freedom of choice does not mean unvaccinated. Why? I'm vaccinated, but don't agree people should be forced to take the vaccine, especially when a law may be written for it to do so. Okay. And if you don't take the vaccine, then there'll be consequences. The law doesn't say that we're going to come and jab you in the arm like what we did during the polio days, because that's how it happened. The law says if you're on a work permit or you're renewing a work permit, applying for a work permit, this is a requirement, just like other things are a requirement. And if you don't fulfill the requirement, then you don't get a work permit. You stay where you are. You go back home. Consequences. Nobody's forcing you to get it. You have a choice. You can say no. Just like people can say no and be without a job or feel like they want to resign, then that is definitely not an issue, folks. You can do that. You understand? It's not about it's not about we're going to force it in your arm. It's about we're going to mandate it. And if you choose not to, then you've got choices. Child, please, Philip, let me not say anything more about the progressives, because I think that puppet master, bit says it quite frankly. I couldn't possibly say it any better. It's perfect. Alden is the one who's running the show. We all know that. And now it's all about playing politics. It's trying to get a few brownie points and trying to undermine the government. Hot mess. Ay, ay, ay. Y'all need Jesus. This should be mandated for all. Thank you, Charles. No human rights when it comes to worldwide pandemic. I think people really don't understand human rights. We don't have human rights once it impacts the next person, physically or mentally, or I mean, listen. Other Caribbean islands, yes, thank you, Ms. Brenda. A number of them have mandated it as well. Yes, let's take away the human rights element and mandate it for everybody. That solves that problem. How about that, y'all? Ready? So, what is the solution that the progressive government is entertaining? What is their solution? Stay closed forever and pretend that they can just print money? What a mess. His own words and position conflict with the party line, says another person, now being rolled out. They had no plans and no solutions to help Cayman to move forward. Well, that's obvious. They were just going to try to give you additional money, which they knew they had no way of paying for. Ugh. The hypocrisy of it is really quite amazing. So, you know, it is what it is. Ugh, what a mess. Everybody wants to talk about human rights. The same people who were keen on denying others their human rights now want to say that, oh, well, now we have human rights too. We want pro-choice. Have a look at this.
Workers everywhere telling us the overwhelming majority of patients are unvaccinated.
And tonight, ABC 13's Shelley Childers met one of them, a former pro athlete and local restaurant owner in his early 40s. And Shelley, he's being pretty open about this. He says he was brainwashed by misinformation.
Yeah, that's right. Like Gina said at the top of the newscast, those were his words, not ours. He tells us that the more he read the rumors, the more he heard the lies about the vaccine, the more he believed it all. Tonight, he regrets not speaking with his doctor. He regrets not getting the vaccine. This father of two nearly died, and he wants to save others from making the same mistake. Recovering from home, Andres Pedikowski says he's lucky he survived COVID-19.
I couldn't breathe. I couldn't not even walk 10 steps.
That was the night he arrived at Memorial Hermann Hospital, where even though he could not breathe, he still had to wait 6 hours for a hospital bed. The father of two telling us he was asking for a vaccine from that bed, certain he was going to die.
Your head go through many things, your kids, your family. Why didn't get vaccinated?
Do you regret not getting vaccinated?
Of course I do.
The local restaurant owner says he chose not to get the vaccine because he was swayed, even brainwashed by misinformation.
You hear so many bad things about the vaccine, and through people, through social media, through a lot of things.
And even when his wife got vaccinated, he chose not to, steadfast that he was young enough and healthy enough. He's 43, doesn't smoke, doesn't drink, and he's a former pro soccer player.
COVID doesn't care about your age, doesn't care about your health. It doesn't care about anything.
And Memorial Hermann tells us he's one of hundreds of young, healthy patients, unvaccinated, and now tethered to lifelines.
So it's really the young and middle-age group that's been hit the hardest by Delta. And of course, that's the group that has the lowest overall vaccination rates.
The three vaccines in the U.S., Johnson & Johnson, Pfizer, and Moderna, were each tested on tens of thousands of people and have already been administered to hundreds of millions. Like Pedikowski's wife, who tested positive for a COVID breakthrough case. She had mild symptoms and was able to recover comfortably at home.
You do it for your kids, do it for your family, do it for yourself. Because even if you don't have a family or you don't have kids, nobody wants to die.
Shelley Childers, ABC 13 Eyewitness News.
Wow. I mean, I've never seen so many people have regrets about a single decision. Everybody's like, oh, it's my choice, it's my choice, it's my choice. And the vast majority of people who've made that choice, here's the kicker, when they are in the trenches and it hits the fan, right? They are then saying, please listen to me. I made a mistake. I was brainwashed. I listened to misinformation. Don't be like me. Listen to the experts. The vaccine helps. Oh my gosh. It's like, come on, folks. Seriously. Right? Okay. So let's set the record straight. Those of you who are waiting for the count of people that were involved in the what do you call it now? The protests. So the Compass counted 400 or 500 people according to them. Some guy on Facebook messaged to claim that there's 1,000 people there. And I've heard all sorts of numbers in between. So I tasked someone who had time. Obviously, I didn't have that kind of time this weekend. I was sick. To go through and count the number of people. So let's have a look at what we discovered, folks. There you go. All right. So they had a couple hundred people out there. Let's round it up. 350. Give them a few more. Maybe there's some people on the other side. What percentage of that is 350 of 70,000 people? Hold on. Let me pull out my percentage calculator. And of course, they're going to say, oh, yes, well, you know, there are people who wouldn't. Okay. All right. Let's give them, let's say it's even 1,000 people. 70,000. We're going to round it down for their benefit. That's 1.43% of the population. Let's give them 5%. Say it's 5% of the population. Should the rest of us be subjected to and beholden to the wishes of 5% of the population? This very vocal minority? In what world does that happen? I'm just wondering. So one of the interesting things is over the weekend, we're going to talk about this one tomorrow, I think. There is the potential for a new antiviral drug to be extremely helpful in the fight against COVID once you get infected. And again, the real fight here, folks, is to save your life and keep you off of a respirator and dealing with long-haul COVID disease. That is where it matters the most, right? And so if you do not understand that that is where the fight is, everyone will get COVID. Let's proceed on that assumption. It is going through every single school in the Cayman Islands. It's now in primary schools, preschools, everyone will get it. That's an underlying assumption that the medical community is saying, hey, this is where we're at. Everyone will be infected. So it's not about preventing a COVID infection anymore. I mean, you do your best, but that's not where the real fight is at. It's about giving you a fighting chance, just like I'm going to survive this cold. In a couple of days, I'll be fine. It's giving you that level of protection. And so there are drug companies who are working on all fronts, not just the vaccine. So again, the research shows, folks, I'm going to put the link here in case you missed the article. You need to go and read this article that talks about the protection that you will get from the vaccine. All right. So vaccinated people are less likely to spread it. This is now a proven, based on over 100,000 persons, situation. There's the link. If you go in the story, click on where it says data demonstrating. Let me bring it up for you. So when you go here and you click on this data demonstrating, it actually takes you to the study. Read it, folks. Okay? Stop letting people tell you stuff when they don't even bother to read. This came out last week, Thursday. Brand new information. They suspected that that's what was happening. And there are other studies, emerging evidence was telling them stuff, and that's why they were suspecting it. Transmission dynamics and epidemiological characteristics of Delta variant infections in China. They tell you about the background, the methods, the results. About the latent period, about the incubation period. Incubation period was 4 days, between 4 days and 5.8 days, respectively. So, you know, when y'all sit down and talk about, oh, they're going to reduce it to 7 days right now, what does that mean? Folks, read, and read. 7 days is a respectable vaccination period. The vast majority of people, if they have it, would test positive between that time. So we know the Delta variant has changed the landscape of this virus. It's not like the original, none at all. And what does that mean? There's information here. So stop pretending like you're an expert, folks, and just simply read and educate yourself. Stop just buying into all this foolishness that people are telling you. You know, you don't want to accept anything that the medical profession has to say. Here's another study out of Singapore. Virological and serological kinetics of SARS-CoV-19 or COVID-2 Delta variant vaccine breakthrough infections, a multi-center cohort study. So because Delta variant, which is now accounting for the almost 100% of the infections around the world, changed the protection that you get from the vaccine and changed the landscape of everything we know about the vaccine, these studies and this information is ongoing. So this is why you've got to keep on top of things. And this is why, as we get new information, we will put it up on the website. We will inform you. Okay? Go and read about the pill. Where's the one about the pill? Big shout out to Kenneth Bryan. I don't know if you guys saw that interview, but thank you to him. There's a one here about the pill as well. Now let's talk about some other very, very sad news that came up on Saturday. Our condolences are being extended to the family of Mia Marcano. Unfortunately, they found what they believe is her body on Saturday morning after 10 o'clock in the morning. They have to wait on the official medical coroner's report to 100% confirm that it's her, but ID found at the body location and other things point to the fact that this is her. So they notified her family. They have said the Orange County Sheriff John Mina has said that they're not looking for any other persons in this case. They believe pretty conclusively that Armando Caballero, who has now committed suicide as of last week, is responsible for this crime. And there's no other person or persons that they're looking for. 19 years old, quite unfortunate. And, you know, her life has been taken from her by someone who was infatuated with her and just could not leave her alone. They worked at the same place, the same condo apartment, apparently. They've been tracing his cell phone records. That's how they were able to locate her body, folks. His cell phone records, they had him, apparently his cell phone records had him all over the place. And they think he was doing that on purpose, trying to create an alibi that he was traveling all over. But the one thing that they know is for almost an hour, he was at this particular location. So when they got the cell phone data back, they said, oh, why would he be at this particular location? And apparently it's somewhere that he used to live before, in the vicinity of Timber Scan condos off of South Texas Avenue. And he lived at that actual complex at one point in time. And so that is where her body was actually found. Very tragic situation. And they had over 60 detectives working exclusively on this case. They also brought in the FBI late on Thursday because apparently the FBI has access to federal agency technology that the sheriff's office could utilize. So our condolences goes out to Mia Marcano's family. Such a tragic loss. I think her parents only had her and a brother, and now they've lost her, and under very, very tragic circumstances. Absolutely horrific. Elizabeth says you're a joker. I don't know who she's referring to, but okay, Elizabeth. Vanessa says, so if vaccinated tourists need to only be quarantined for 7 days, why do vaccinated Caymanians need to be quarantined for 14 days? Well, that's not correct. Everyone who is vaccinated gets the benefit of a reduced time. Unvaccinated people have to quarantine for the full 14 days. I'm a little bit confused. Now, if you're saying that when there's an outbreak in a school environment, well, the protocols for that, and I think that's maybe where you're saying that, not travelers. The protocol for that right now is 14 days. Why? I think out of an abundance of caution, to be quite frank. They've kept it at the upper limits when it comes to local transmission cases. And again, because it has to do with the school environment and with children in particular. And we see how it is, going through those very, very quickly. So Jerry says there's a new variant called R1 affecting vaccinated people. But two things. Number one, it affects, all variants affect everybody. Delta affected, vaccinated people too. The news is already saying that a COVID variant making headlines in the US is not circulating in Canada, nor is it likely to overtake the dominant Delta strain. This is what they're saying so far about the R1 variant. So stories in America, news outlets about the R1 variant have emerged, questioning its mutation and the potential threat it poses. Specifically, the strain is getting attention in California. But, important, but the Los Angeles Times has reported that the mutation has already died out already. This is where you got to keep reading. The R1 variant was concerning because it has a few mutations that might avoid antibody responses, says a virologist at Johns Hopkins Bloomberg School of Public Health. At the time, though, it was just before Alpha in the US made its first trip through the country, followed by Delta. And once Alpha and Delta came through, R1 essentially disappeared from most people's radar screens. So that sort of told us that the Alpha and the Delta were probably better viruses at spreading than the R1 was, even though all R1 has some mutations that would make it concerning to us. The R1, the World Health Organization first reported that R1 was circulating in multiple countries in January, but it never made variant of interest classification. Folks, that's not entirely new when it comes to variants. We're now in October. This is a Canadian newspaper saying that it did not make any significant impact in Canada. A spokesperson for the Canadian Health told Global News. Today, R1 isn't even active in Canada, though the country has logged 48 cases of the mutation to date. Most of those occurred in March and April, with the last R1 variant being reported on April the 20th. So, you got to keep reading. It's not new if it's been around since January, first of all. Not as far as variants go. And on top of that, it's already burning itself out because apparently the Alpha and the Delta tend to be, from what it's showing, tend to be the ones that are really on top of things. A virologist says, this guy says, as a virologist, I always pay attention to these variants and particularly pay attention to any mutations that might pick up along the way. But right now, everything in the US is about Delta. And we're most worried about what Delta is going to do. Is Delta going to change? Is Delta going to continue to evolve? But because it seems to outcompete all of the other variants. I'll put the link here for you to continue reading what the virologist has said about that R1. Okay? Many more sources for it that can tell you all about it. But it has been around for a minute. Folks, a lot of people in Cayman are worried about this happening now in our schools. Every school looks like they're going to be impacted by this. Make sure you tune in tomorrow.
Parent, every grandparent, and every soon-to-be parent need to watch the CMR COVID Spotlight on Tuesday, October 5th. That's when we have a pediatrician who is also an infectious disease doctor on the show to answer your questions about children and COVID.
All right, folks, she's the expert. Children and COVID. If you miss this, then you don't really care about your children. I got to be honest with you. Ask the experts, folks. It's as simple as that. Do not miss this opportunity to be properly informed. It doesn't get much better than this. You've got these experts at your fingertips. Go look her up. Look up her credentials. Don't take my word for it that she is super qualified. Dr. Claudia Espinosa has a who's who list of things that you should be reading about her. Associate Professor of Pediatrics, MD, MSc, Division of Pediatrics and Infectious Diseases at the University of South Florida. She completed her residency in pediatrics at the University of Kansas and her fellowship in pediatrics and infectious diseases at the University of Michigan. Dr. Espinosa is board certified in pediatrics and pediatrics infectious diseases. Her research interests include perinatal and congenital infections, hepatitis, and vaccines. Wow. Amazing. Don't miss this, folks. Do not miss this. Thank you so much for tuning into the program. Charles believes in population control. Why is the vaccine made for free? Well, if it wasn't free, you'd be complaining about that too. When it's a public health crisis, Charles, that impacts everyone, it would be unconscionable that anyone would want to charge for vaccines. But y'all don't even see the game. And some of these physicians here locally who wanting to bring in other vaccines, that's their intent, to make money off of it. They fully intend to make money off of their vaccine and to charge you. You need to be asking, why would they be charging you? This is a public health crisis. Why would anybody be seeking to charge you? Oh, sorry, Charles. He says he's trying to explain the reasons. Let's talk about it tomorrow, folks. We've got more time. We're definitely out of time. We've got into overtime this morning. My throat needs a break. I want you guys to have a wonderful day. It is Monday. I think I need to head to court and see what's popping off over there. I'm sure there's a lot of court cases that I've not even been catching up on. But we got to keep the train moving forward, folks. That's what it's all about. Let's keep it moving. You guys have a blessed day. And as always, get your information from reliable sources. That is what matters the most. All right, my good people. Thank you so much, Miss Sue. I'm not feeling too horrible, but yeah, there's a little bit of strain in the throat. So we'll keep it moving. Y'all have a wonderful day.
Thank you for tuning in to another edition of The Cold Hard Truth. Make sure to check Facebook for showtimes and more information and the latest news at CaymanMarlRoad.com. Subscribe to our IG and Facebook pages to get the latest happenings.